Hello, everyone. I'm Joanne Bazubitz, President and CEO of the Royal, one of Canada's leading mental health and research centres. My team and I are very pleased to partner with Rogers TV Ottawa for another special edition of Conversations at the Royal during Mental Health Week. As a care, research, and teaching hospital, our goal is to bring the latest information on treatments and research findings in mental health to you, the public. At the Royal, we provide care to individuals from 16 years of age to the very elderly, all who experience important mental health and substance use challenges. We also serve veterans and active members of the Canadian Forces and RCMP for operational stress injuries incurred while serving our country on humanitarian missions. Every client at the Royal receives best-in-class care, informed by cutting-edge research to live their best lives. This week, you will hear from our many amazing clinicians who are passionate about the care they provide and the research that will lead to novel treatments and new discoveries in mental health and addictions care. Today's talk is about substance use challenges and well-being and what it means during an ongoing COVID pandemic. I'm very proud to introduce Dr. Isabelle Ayres, a psychologist with our Substance Use and Concurrent Disorders program and a researcher in the Research Institute. The Royal is one of the few mental health centers who treat substance use and mental health problems concurrently, not separately. And for us, that's important because we treat the whole person. We don't ask whether it was a substance use problem or whether the mental health problem came first. Clinicians like Isabelle care about tailoring services to help every individual achieve their personal goals. Isabelle is a very compassionate psychologist in our program, and she will share information about how the COVID-19 pandemic has affected how people use substances. You will learn to identify the symptoms of substance use problems and the links between substance use, mental health, and trauma. Isabelle will share many helpful coping strategies, and she'll outline ways to access treatment. Thank you for joining us in Conversations at the Royal and learning more about substance use and mental health care.
Hi, I'm a psychologist working at the Substance Use and Concurrent Disorders program at the Royal Ottawa Mental Health Centre. And I'm really grateful to be able to speak about substance use and mental health in the context of the COVID-19 pandemic. It's an area that affects so many, and it's very important to share, learn, and understand, and reach out for help. Before I start my presentation, I'd like to thank Dr. Overton and Dr. Kreis for their contributions to this presentation. Next. So I'm hoping that there are a few key points that you'll be tuning into as I go through this presentation. We'll start with an overview of substance use. We'll discuss substance use interactions with mental health and trauma, the impact of COVID-19 on substance use in Canada, and then we're going to wrap up with a section where we check in with yourself and your loved ones, look into some coping strategies and some resources to access care. Next. So although the talk does focus on substance use, I wanted to highlight that substance use is just one piece of a complex puzzle. Next. So here is a visual representation of the connection between substance use, mental health, and trauma, and all these other things, all these other components that can kind of contribute to these different areas, like poverty, gender identity, age, disability, lack of access to healthcare, compounded stigma, sexual orientation, legal history, incarceration, systemic discrimination, and racial discrimination. Next. As for the cost of substance use in Canada, In 2017, the total societal cost of substance use in Canada was estimated to be $46 billion. And substance use led to 275,000 hospitalizations and contributed to the loss of 75,000 lives. Next. So, what psychoactive drugs are Canadians using? We haven't captured caffeine in this graph. Caffeine would definitely be the drug that most Canadians tend to use. But as you see here, we have the blue bar is men, the yellow bar is women, and close to 80% of men and women will have used alcohol in the past year, I believe. And then the next substance would be tobacco, followed by marijuana, and then other illicit substances. Next. So when we look at alcohol use, we like to think about low-risk drinking and higher-risk drinking. So we're going to be covering the low-risk drinking guidelines later on in this presentation. And here we're going to be looking at both the chronic risk and the acute risks associated with drinking and breaking it down by age category. So in terms of chronic risks when it comes to alcohol use, really what we're looking at are long-term risks to someone's health in terms of liver disease or certain cancers. When we're looking at acute risks, we're looking at the risk of injury and overdoses, so the immediate risks associated with substance use. So if you look at this graph, what you'll notice is that about 23% of youth aged 15 to 19 are using alcohol at a rate that increases their chronic risks in the long term from their alcohol use. And 13% of youth are using alcohol in a way that increases their acute risks. The age group where the numbers are much highest are people aged 20 to 24, probably university or college age people. And there, the chronic risks are at 31 and the acute risks are at 26%. And then the last category are adults 25 and over. The chronic risks are 22% and the acute risks are at 17%. Next. When it comes to cannabis use in Canada, these surveys have asked people in the past 12 months whether they used cannabis. And on this graph, you'll see differences between 2020 and 2021. It's separated between males and females and different age groups. And the little star that you see there is when there is a significant difference between the figures that were obtained in 2020 and those that were obtained in 2021. So as you notice, around 30% of men and around 22% of women reported using cannabis in the past year. In terms of the 16 to 19-year-old age range, we're hovering around 40%. In the 20 to 24 age range, it's around 50. And in the 25 plus age range, it's around 23. And when we look at the impact of COVID on cannabis use, about 49% of people who use cannabis say that they use the same amount. 22% said that they use less, and 29% said that they use more. And of those that said that they use more cannabis, it's really the youth who tend to use more cannabis. So that 16 to 19 year age range, as well as the 20 to 24 year age range. Next. Now for opioids. As many of you know, Canada is in the midst of an opioid crisis. Sorry, as I adjust my desk. And when we look at the impact of COVID on opioid-related harms in Ontario, since March 2020, we found that there has been an increase in emergency medical services related to opioid overdose, and this increase was of 57%. And when it comes to fatal opioid overdoses, there has been an increase of 60% since March 2020. And when they look at which groups are more likely to experience opioid-related harms, it is marginalized and racialized populations who are most affected. And what they find when they conduct autopsies of people who have died from an opioid overdose is really levels of fentanyl, sedatives, and stimulants that they find in these autopsies that led to the overdose. And it really points to an increase in the supply of unregulated opioids and other drugs that is becoming a bit more volatile during the COVID pandemic. And why is it that there has been an increase in opioid-related harms? So the research suggests that that may be linked to pandemic-related stress, social isolation, mental illness. Many restrictions to our borders and to traveling have created unregulated drug supplies that are more erratic and volatile. And there has been a reduced accessibility to treatment for addictions, mental health, and harm reduction. Next. So when we look at addiction, we think of addiction as a treatable, chronic medical disease that involves a complex interaction between brain circuits, genetics, the environment, and a person's life experiences. People with addictions use substances in a compulsive manner despite many, many negative consequences. And historically, we thought of addictions as being caused by a weakness in character, poor morals, or poor lifestyle, or a choice. And this is absolutely incorrect. And it's a dated concept, and we really need to change the way we are thinking about addictions. Addictions are a chronic disease, and it begins in childhood or adolescence. And just like other chronic diseases, it goes through periods of relapses and remission. And when we look at prevention efforts or treatment approaches for addictions, they're generally just as successful as prevention efforts and treatments for other chronic diseases. Next. So when we consider substance use, people who use substances don't necessarily meet the criteria for problematic use, right? If someone uses illicit opioids from time to time, that doesn't necessarily mean that they have a problem with opioid use. So we really do have to kind of consider the spectrum of substance use, on the one end ranging from occasional recreational use to frequent use to problematic use. Next. There are many risk factors that contribute to substance use problems. It's not just one factor. In terms of these risk factors, we'll consider the person and whether or not they're vulnerable to developing substance use problems. So some people have a genetic predisposition to developing substance use problems. For instance, if members of their family have had difficulties with addictions and that sort of thing. Mental health struggles, trauma and violence, or other biological factors can make someone vulnerable, like sex and gender differences. When we look at the environment or the social cultural context, certainly people who come from more disadvantaged backgrounds are at increased risk of developing substance use issues. Individuals who have a lack of support from primary caregivers, when individuals are in a certain peer group where experimenting with substance use is part of the norm, or if there are certain stressors, right? COVID being one important stressor that has contributed to increased substance use. And then finally, we'll look at the substance use itself, or the substance itself. And there are certain aspects of that that can lead to addiction. So for instance, how available a substance is. It's no coincidence that rates of alcohol consumption are greatest among Canadians compared to other substances, because alcohol has been the substance that's been most available to date. Now cannabis is becoming increasingly available. The cost of the substance will impact how likely it is that someone will develop an addiction. How quickly the substance reaches the brain as well. So of course, if a substance is injected or smoked, it'll reach the brain faster than if it's taken orally or if it's used intranasally. How effective the substance is as a tranquilizer or as a sedative, And finally, with repeated use, so the more someone uses a substance, the more they'll develop certain tolerance and withdrawal type symptoms that can then lead to ongoing use and eventually potentially an addiction. Next. So when we look at diagnosing substance use problems, we refer to the Diagnostic and Statistical Manual, and we're looking at substance use disorders. Now, certain diagnoses are made based on the substance that is problematic, right? So people might meet criteria for an alcohol use disorder or a cannabis use disorder or a stimulant use disorder. But generally speaking, we have these four main categories. The first one being impaired control. So really this category has to do with having a hard time controlling your use, right? So people use more substances than they intended to use. They want to cut down on their use, but they're having difficulties cutting down or reducing their use. They spend a lot of time using substances, searching for substances, or recovering from the effects of the substances, and they experience cravings. Next, we have social impairment. So how the substances impact your social functioning. So for instance, people having a hard time fulfilling major obligations, for instance, in terms of work or family, that they use despite having problems in social functioning. Again, family, work, friendships, and so on. And that sometimes they reduce or stop important activities, and this time is then devoted to using substances. The next category is risky use. So people using in physically dangerous situations, for instance, drinking and driving, or using despite physical or psychological consequences. So using despite some consequences to people's health or their mental health. Right? It's, for instance, someone who has symptoms of psychosis who continues to use cannabis despite the fact that cannabis will increase those symptoms of psychosis. And finally, we have the pharmacological criteria. So when it comes to substance use and people who develop a problematic pattern, there tends to be a development of tolerance, right? So your tolerance becomes increased over time. You need more of that substance to have the desired effect, or the substance that you're taking at a certain amount is no longer giving you the same effect. And there's also withdrawal. So when someone is not using the substance, they're experiencing withdrawal symptoms, or they continue to use just to avoid experiencing those withdrawal symptoms. And certainly there are classes of drugs or medications where tolerance and withdrawal are to be expected and are not considered as criteria when it comes to substance use disorder. So for instance, when it comes to opioids or benzodiazepines, it's normal, even with regular use, to develop a tolerance to those substances and to develop withdrawal symptoms when we stop using those substances. So I'll go to the next slide now. So when does substance use become a problem? And this is a quick heuristic to determine whether or not someone's substance use is a problem. It's called the 4 C's of addiction. So the person would describe having cravings, experiencing a loss of control over their use, using despite negative consequences. So for instance, negative consequences to health, mental health, work, family, and so on. And there being a certain compulsivity associated with the use and need to continue to use. Next. So now we'll really kind of zero in on substance use and mental health during the COVID pandemic. And when we consider the COVID pandemic, there are so many things in our lives that have been affected by COVID. And this is just a bit of a snapshot of those aspects of our lives that have been affected and how it might contribute to difficulties with substance use and mental health. So for instance, job loss, housing insecurity, social isolation, gender-based violence, more consuming of news and social media, increased stress, anxiety, and loneliness, burnout for essential workers, higher risk of disease due to work, caregiving and housework, homeschooling, not getting as much exercise as you previously did with gym closures and so on, and just the economic stress of COVID. Next. So there is a well-documented relationship between mental health and substance use. People with mental health problems tend to use more substances. People with substance use problems tend to have more mental health problems. And what research has found is that COVID has strengthened, has augmented this relationship. And they're noticing that Canadians who had past or current mental health concerns increased their substance use during the pandemic. And Canadians who had past or current substance use concerns reported more mental health symptoms. Next. So I'm going to be looking in a bit more detail when it comes to alcohol use and cannabis use and opioid use as well. So here, this is a large-scale survey of individuals who are 16 and older, taken at 2 different time points. And what they're noticing is that about 30% of respondents who use alcohol reported an increase in their use during the pandemic. So about 1 in 3 respondents reported increased use, and about 1 in 5 reported problematic use of alcohol. And if you look at the graph to the right, what you'll notice is that people who have current mental health symptoms, or people who have had a substance use disorder, who currently have a substance use disorder, are more likely to report these increases in alcohol use during the pandemic. I'll go to the next slide. And when it comes to cannabis, about 40% of respondents who use cannabis reported an increase during the pandemic. And so you can notice here that it's about 40% on the graphs to the left. And again, those who have had a mental health disorder in their lifetime or currently, or those who have had a substance use disorder in their lifetime or currently, are more likely to report an increase in their cannabis use during the COVID pandemic. And so then we consider, what are some of the reasons for this increase in alcohol and cannabis use? And some of the suggestions are, especially early on in the pandemic, there was a lack of a regular schedule. Our days were very unstructured. People felt bored. They experienced stress and anxiety. And a lot of people experienced loneliness. Next. So now we're going to put the spotlight on Canadian youth aged 16 to 24. And these were surveys conducted by the Canadian Centre on Substance Use and Addiction, and that was recently published in 2022. And what they noticed was that youth reported experiencing more symptoms of depression and anxiety during the COVID-19 pandemic. So about 24% reported moderately severe to severe depression, 42% reported moderate to severe anxiety, and 17% reported suicidal ideation. And only 1 in 4 youth reported having excellent or very good mental health. That means that 3 in 4 reported otherwise. And when we look at substances in particular, so youth who use alcohol, cannabis, or both, were more likely to report increased use. So about 37% reported increased alcohol use, 29% reported problematic alcohol use, so at present, 45% reported increased cannabis use, and 51% reported problematic cannabis use. Next. And the top 4 pandemic-related stressors identified by youth aged 16 to 24 in Canada were, difficulties with school, school closures, catching up with schoolwork and all those types of things, maybe not having as many interactions with friends at school. Mental health concerns, their financial situation, and social isolation. And when they looked at access to treatment, only 1 in 4 youth with mental health symptoms access treatment, and less than 1 in 3 youth with problematic substance use access treatment. So there was a real disconnect between those who experienced mental health and substance use difficulties and those who accessed treatment. Next slide. The other area that was kind of focused on by the Canadian Centre on Substance Use and Addiction were households with young children. And they looked at mental health problems and substance use concerns in these households. And they defined young children as children younger than 13. So, and then they separated their findings based on men and women. And so the first part is what percentage of men and women report excellent to very good mental health. So it's about 44% of men and 29% of women. In terms of those reporting moderate to severe anxiety symptoms, about 24% of men and 37% of women. And in terms of those reporting moderate to severe depression symptoms, it's about 17% of men and 19% of women. And generally speaking, women do tend to report more difficulties with anxiety and depression than men. But these numbers are still of concern. And then when they looked at substance use, about 26% of men reported an increase in alcohol use, and 37% of women in these households with young children reported an increase in alcohol use. When it comes to an increase in cannabis use, it's about 37% for men and 48% for women. When it comes to problematic or risky alcohol use, about 28% of men will engage in problematic or risky alcohol use, and 18% of women will. And when it comes to problematic or risky cannabis use, that's 39% of men and 35% of women. Next slide. Then we look at what were some of the top related stressors in these households with young children. And men would say social isolation, their financial situation, and their personal relationships. Whereas women identified their financial situation, caring for one's children, and social isolation as the top 3 pandemic-related stressors. Next slide. Finally, when we look at the COVID-19 pandemic, there's also what the United Nations has coined the shadow pandemic of COVID-19, related to gender-based violence. Before the pandemic, globally, there were 243 million women and girls aged 15 to 49 who experienced sexual and or physical violence by an intimate partner in the past year. And since the pandemic, there has been an increase in violence against women. And there have been worrying trends across countries, including Canada, where there's been an increase in phone calls to helplines that target women who are experiencing violence at home. And there has been an increase in admissions to emergency shelters to protect these women. The other piece to consider is when there is violence against women, these women are at higher risk of developing substance use problems than women who have never experienced this type of violence. And what the research suggests has made it more likely for women to experience this violence are things like security, health, and money worries, cramped living conditions, isolation with abusers. So during all those lockdowns, being stuck at home with your abuser, movement restrictions, so people couldn't travel, couldn't escape, and deserted public spaces. And that would be if someone is being attacked in a public space. And some of these factors have made it harder for women to reach out for support and to access services, unfortunately. Next slide. So, given the potential impact that COVID has on substance use, mental health, and trauma, it's important that we check in with ourselves and that we check in with loved ones. Next slide. So I'll go through the low risk drinking guidelines, and this is just a helpful tool to assess your alcohol use and to see where you're at, and if your alcohol use is putting you at risk of long-term risks, or if it's putting you at risk of short-term risks, right? So when it comes to reducing your long-term health risks, so again, here we're talking about liver disease or certain cancers, the guidelines recommend no more than 2 drinks per day for women or 10 drinks per week for women, and no more than 3 drinks per day for men or 15 drinks per week for men. When it comes to reducing your acute risks, so those are risks associated with injury or overdoses, no more than 3 drinks on any single occasion for women, and no more than 4 drinks on any single occasion for men. And it's important to plan non-drinking days also to prevent developing a habit. So these Canadian low-risk drinking guidelines are intended for individuals 25 to 65. So if you're younger than 25 or older than 65, the recommendations may be quite different. Next slide. So a drink is not a drink, right? It's sometimes hard to know what constitutes a drink. And in the field of substance use, we tend to refer to them as standard drinks. So a standard drink is 341 milliliters of 5% beer, or 341 milliliters of a cooler or cider that has 5% alcohol content. When it comes to wine, it's a 5-ounce glass of wine of roughly 12% alcohol content. And when it comes to distilled alcohol, here we're looking at 1.5 ounces of alcohol, where the alcohol content may be about 40%. So this just kind of gives you a bit of a benchmark in terms of how much alcohol you're drinking and what constitutes a standard drink. Next slide. So when it comes to cannabis, there are also lower risk cannabis use guidelines. So for instance, cannabis use has certain health risks, and it's best avoided, and these risks are best avoided by abstaining altogether. Delay taking up cannabis use until later in life, right? So the research has shown that youth who use cannabis repeatedly and heavily are at greater risk of developing mental health problems later on in life, particularly psychotic illnesses. Identify and choose lower risk cannabis products. So those would be cannabis products with a lower THC content, for instance, less than 10% THC. And a lot of cannabis that's available in stores these days has THC contents of 20% and above. Identify and choose lower, I already said that. Don't use synthetic cannabinoids. So these would be various products that may be increased in potency. Avoid smoking burnt cannabis and choose safer ways of using. So smoking a joint is one of the more harmful ways of consuming cannabis, especially when it comes to your lungs. Using a vape or eating edibles is a less harmful way of ingesting cannabis. However, it's important to know that when you use edibles, sometimes it can take a while for the effects to sink in, sometimes 30 minutes, an hour, and there is the risk of taking more than you would like if it's taken in an edible format, because you might not be feeling the effects right away. If you smoke cannabis, avoid harmful smoking practices. limit and reduce how often you use cannabis, don't use and drive or operate other machinery, right? So when they look at cannabis, the guidelines are really, they recommend not driving for at least 6 hours after you use cannabis, and it might be longer for edibles. Avoid cannabis use altogether if you're at risk for mental health problems or are pregnant, and generally speaking, avoid combining these risks. Next slide. So if you're wondering where you're at when it comes to your alcohol use, your cannabis use, maybe your tobacco use, or your mental health, your level of depression and anxiety, you can check it out. There's a website here where you can look at your alcohol or cannabis use compared to other people in your same age range and see how you compare to those people. And it might give you a sense of how your use is relative to the norm, and whether or not there's something to be looked into. Next slide. And finally, when it comes to opioids, it's really important to kind of drive the point home that we are in the midst of an opioid crisis. And this infographic raises two key points. The first one being that fentanyl can be mixed into any substance. And so there is that risk of overdosing. Even if someone thinks that they're purchasing cocaine, there's a chance that there's fentanyl in it, and there's a chance that that might lead to overdose. The second piece is to recognize the signs of an opioid overdose. So, for instance, your breathing might have slowed down or gone altogether. Your lips and nails turn blue. You're not moving. The person may be choking or emanating a certain gurgling sound. The person can't be woken up. So if you shake the person, they're unresponsive. Their skin feels cold and clammy, and their pupils are very small. The recommendation really is for people to have a naloxone kit. An naloxone kit reverses the effects of an opioid overdose, but it does so only temporarily. And also because of the increased potency of some of the opioids that are available on the streets these days, sometimes one naloxone kit is not sufficient. And the person may need to have naloxone administered to them several times to kind of keep them out of an overdose situation. Also important is to know that an overdose is always a medical emergency. So if you notice someone overdosing, it's really important to call emergency services and to get the appropriate care. And if you have a naloxone kit on you, to administer that naloxone kit and to monitor for signs of overdose. Fortunately, naloxone kits are available at your pharmacy for free, and you can receive training on how to use it, and it can really save lives. Next slide. So we've talked about a lot of the difficulties associated with substance use and mental health during the COVID-19 pandemic. And accessing care is not always as easy or as straightforward as it seems, right? Sometimes people face barriers to accessing care. So we're going to look at those for a moment. One of our research teams here at the Royal conducted a study that looked at barriers to accessing care, especially among those who use opioids. And what they found was that both women and men had difficulties accessing care. But women reported more barriers related to family responsibilities, relationships, their mental health. And they also felt more stigmatized for their opioid use compared to other substances, right? So women who used opioids experienced more stigma compared to women who used other substances. So these barriers can really make it hard for women and for men to access services. Next slide. So finally, how can you take care of yourself during the COVID-19 pandemic, knowing that it might have led to increased substance use or increased mental health problems? We'll look at some ways now. Next slide. So ways to cope. Keep yourself busy with activities you enjoy, like pets, volunteering, community activities. Stay connected with friends and family while still practicing physical distancing, right? If physical distancing is required. Find balance by staying informed, but know when to take a break from COVID-19 news and topics, right? Sometimes when we look at the news too much, it tends to lead to more stress and anxiety or more depression. Be kind to yourself by remembering that this is a difficult time and you're doing your best to manage a challenging situation. I think that a lot of parents to young children have experienced a lot of difficulties managing work and life and homeschooling. Frontline workers have had a lot of difficulties with work schedules and things that they witnessed at work. It's really important to be kind to yourself. Take care of your body by eating and sleeping well, exercising and meditating. And here they were given an example of a breathing exercise. There are a lot of apps out there that can be helpful for teaching certain mindfulness exercises or certain breathing exercises. And certainly exercising can be really fantastic when it comes to your mental health. Reach out for help by talking with a family member or friend or seeking professional support. Next slide. If you use substances, monitor your use. How much do you use? How often do you use? Reduce the harms associated by your use, for instance, by following the low-risk guidelines. Avoid stockpiling alcohol, cannabis, or other substances. Take medications as prescribed and continue taking medications as prescribed. Reach out if you feel your use is becoming a problem. Next slide. So where do you go for help? In Eastern Ontario, we've now developed a program called Access MHA, and it's a centralized triage program that starts as an assessment, right? So someone would book an appointment and they'd speak to an Access MHA staff member who will assess your substance use and mental health difficulties, and then connect you with one of many, many different services to address some of the difficulties that you outlined. So it's really a fantastic service. So it connects individuals to both mental health services in Eastern Ontario as well as substance use services, or both. And the website URL is at the bottom of the slide here. Next slide. And where else can you go for help? So if you mostly have difficulties with substance use, there's the Service Access to Recovery program, and I've listed the number and the website here. People can be seen fairly quickly through our Rapid Access to Addiction Medicine Clinic for any number of difficulties with substances. And now we have what is called the digital front door. And so people can drop in virtually and have their substance use difficulties assessed pretty promptly and connected to the right services. If people are hoping to withdraw from substances, they can connect with the Ottawa Withdrawal Management Center. There's also Wellness Together, which is a website hosted by the Government of Canada to connect people with substance use and mental health services. You can talk to your family doctor or nurse practitioner. You can seek help through your employee assistance program. And then there are also self-help meetings like Alcohol Anonymous, Narcotics Anonymous, and Smart Recovery. Next slide. When it comes to gender-based violence, where do I go for help? So there are crisis phone or online chats, such as the Assaulted Woman's Helpline. The Crisis Tech Line provides free 24/7 support for those in crisis, connecting people in crisis to trained crisis responders. There are shelters. So for instance, sheltersafe.ca provides information to help connect women and their children across Canada with the nearest shelter for safety and support. And then there's a phone app called My Plan Canada, and it's a free app to help you with your safety and well-being if you've experienced abuse from current or past partners. So this concludes my presentation on the impact of COVID on substance use in Canada. I hope you enjoyed it.